All right, good afternoon and welcome everyone. Thank you for joining us for our webinar this afternoon. My name is Meg Beyer. I am part of the MCTAC, which stands for Managed Care Technical Assistance Center team that is helping to facilitate and coordinate today's webinar. I'm joined by some really wonderful partners from New York State that I'll introduce shortly. Before we get started on the webinar, I wanted to just run through a couple logistics for you so you're all a little bit comfortable and more familiar with how we're going to run our webinar process today. So for those of you who may be wondering, we are definitely recording this webinar, and both the recording and the slides will be made available following the webinar itself. It does take our system about a day to a day and a half to kind of adapt the recording into a file that we can share with everyone. So stay tuned, but we will be sure to share both the slides and the recording itself with you all so that you can review the information, share it with colleagues, or just revisit something if you wanted to. The other thing to say is that we will be having time for questions and answers with our state partners at the end of this webinar. However, we want to encourage you to chat in your questions throughout the entire webinar using the chat box functionality. So if you look to the right-hand side of your screen, you'll see a little box that says chat, and you'll see a line that actually says send to with a colon. And what we're asking you to do, if it's possible, is for you to click next to that arrow and select all panelists and chat your question in that way. That way, all of our presenters today will be able to see your questions as they come in. We also know, having done a couple of these webinars, that we get a ton of questions. So one of the things that my wonderful colleague, Caitlin, who is helping us to coordinate today's webinar, and I will do, is we collect all the questions into one centralized location so that at the end, we can run through them with our state partners. And knowing that sometimes time runs short and we don't get to address all the questions that come in, we want to assure you that your questions are captured and we are able to share them with the state afterwards. So even if your question is not answered on the webinar today in the time that we have, please know that the state will still receive it and they'll be able to review what you chat in. So please don't hesitate to send in your questions. We are happy to collect them all, and we will be sure to make sure that our state partners receive them. So with that, speaking of our wonderful panelists and state partners, I just wanted to let you all know that today we are joined by Mary Beth Foster from OMH. We are joined by Joe Stinson, who is the Deputy Section Chief for Recovery with New York State. And we are also joined by Joe Colarafi, who is also the Deputy Section Chief for Recovery for New York State. So I want to thank all of our presenters who are about to walk us through some information. And I'm going to, with that, ask Mary Beth to take it away.
Thanks, Meg. Good afternoon, everyone. Thank you for joining us today, taking some time out of your busy schedule. As Meg said, my name is Mary Beth Foster. I am the Director of Fiscal Internal Controls Compliance at the Office of Mental Health. The Office of Mental Health wanted to be certain that community health providers were aware of the guidelines for COVID-19 FEMA public assistance reimbursement during this COVID emergency. One step beyond that, we wanted to afford you all the opportunity to ask any specific questions you may have about the procedure. And the Division of Homeland Security Emergency Services, or DHSES, has graciously agreed to be part of this webinar and offer their expertise to address these questions that you may have. DHSES has been conducting applicant briefings that you're all encouraged to attend prior to this webinar. And today I'm just going to highlight some of the key takeaways that I got from attending these applicant briefings, address some of the frequently asked questions I found on their website, and then turn the presentation back over for your questions and their answers. So we'll begin. There we go. Actually, I just was enlarging everything. Sorry about that. All right. So we already mentioned that OMH and DHSES welcomes you to the question answer forum, specifically for the community mental health not-for-profit providers. This slide is basically talking about a couple of important factors specific to this COVID emergency. For those of you who may be familiar with applying for FEMA reimbursement in the past, this emergency is considered Category B, meaning that it will cover or reimburse for emergency protective measures. And the deadline to do so is September 19th, 2020, and New York State can grant a 6-month extension upon that request. Again, if you have more questions on that, it's on the DHSCS website, or Joe and Joe could fill you in more about that. This disaster is every disaster gets a name, and this one's referred to as DR4480. So you may hear references that in the future, or on the website, you would look for DR4480. One of the key things that was stressed time and time again is that FEMA public assistance is a reimbursement funding, and it's the payer of last resort. So there are other grants or other funding available, Medicaid. Those would be things that would pay for expenses in the first instance. Again, FEMA reimbursement is the payer of last resort. And the minimum monetary threshold for an eligible project is $3,300 in eligible costs. Again, just some highlights of information for you. Eligible expenses must be directly related to protecting the public health and safety during the COVID-19 event. They are incurred as a result from which the organization has a legal responsibility to perform. And that's another fact that's been highlighted time and time again. In order to claim reimbursement, your organization must have a legal responsibility to perform those services. And they must meet the requirements of the pyramid of eligibility, which we will talk about on this slide. So the pyramid of eligibility just discusses the different components of being eligible. So you have to meet all of those in order for expenses to qualify. You have to be an eligible applicant. You must have an eligible facility, eligible emergency work, again, legal responsibility of the applicant, and there must be an eligible cost. And those costs must be reasonable and necessary to protect the public health and safety from COVID-19 virus. And when people start asking questions about, is this covered or that covered, one of the big takeaways I got was that in order for something to be covered, you just have to tack on, well, is it reasonable and necessary to protect public health and safety from the COVID-19 virus? An eligible applicant has to meet certain qualifications, but more often than not, private nonprofits or PNPs are eligible applicants. They must be able to provide certain documentation saying that they are private not-for-profits. They are able to document that they are organized or doing business under New York State law as a non-revenue producing nonprofit entity, and must operate an eligible facility. And Joe can get more into that portion of it. I believe it can even be if it's for a short term, but they can speak to that. An eligible facility must be owned or operated by a PNP that provides an eligible service. So these all kind of roll into one another. First, you have to be an eligible participant, and then you have to have a facility. So in order to have an eligible facility, you have to provide an eligible service. Legal responsibility, the facility has to be the legal responsibility of the applicant. The facility needs to be in active use at the time of the emergency. And the facility cannot be under authority of another federal agency. Eligible work, again, Category B means that eligible work has to be emergency protective measures, and we'll go into a couple of examples of that in a later slide. The work must be directly related to and required as a direct result of COVID-19. The work must be completed within the regulatory time limits, And once again, can't say it enough, the work must be the legal responsibility of the eligible applicant performing the work. So when we talk about the legal responsibility of the eligible applicant performing the work, if it is something that, if it is work or services that you are required to do as part of your day in, day out, that would be your legal work, your legal responsibility. If, however, a state, local, tribal, or territorial government entity has directed you to perform those services, it's outside of your realm of what you would typically do, but you have been told you need to do this, then you would have to go through that legal entity. And because it's their direct legal responsibility, they would be the ones submitting for reimbursement, but you in turn would be billing them. So whoever has the legal responsibility directs you to perform a service, you perform the service, but you would have had an agreement that they would pay you and then they would go get the reimbursement. So if you have more questions on that, Joe and Joe are great at explaining it. But again, just think legal responsibility. Is it yours? If not, whose is it? And then if you were tasked for doing that work, you would bill them. So if a PNP does not have a legal responsibility to provide services or commodities, then any associated costs are not claimable for reimbursement by that PNP. Eligible work, some examples are emergency operations centers, emergency medical care, medical sheltering, medical supplies and equipment, security and law enforcement for temporary facilities, and communications of general health and safety information to the public. Again, this gets back to emergency protective services. Eligible costs would include force account labor, equipment and materials, contracts, and management costs. The costs must be reasonable and necessary to accomplish the work, and they must be compliant with all the procurement requirements for federal, state, and local. Reduced by any applicable credits such as insurance and other funding sources. Again, that gets back to the FEMA public assistance being the reimbursement funding of last resort. So any costs you have, if they're offset by something else, you would subtract that out, and then that's what you could apply for reimbursement. So what are your first steps as a PNP? The very first thing that you would want to do is visit the DHSCS webpage. It's here. You'll have access to it through when you can get a copy of this on the portal, but it's very easy. If you just Google DHSCS, it'll take you to their webpage. You can go to declared emergencies, and then you look for that DR 4480, and you're there. And I've got to say, I went to the applicant briefings when they were first being presented, and I hop on every now and then for new information, but that web page, it has grown. I feel like every day there's new information. DHSCS is wonderful about keeping on top of things and keeping everybody informed. If you're thinking about applying for federal reimbursement, I cannot stress enough that you go to this web page because you will find a wealth of information there. You'll find copies of the applicant briefing presentation, which is what I was talking about, that everybody is encouraged to attend because you get more details than what you're given here. The request for public assistance application, very easy to fill out. Procurement guidance, non-congregate sheltering is on here twice. I guess we want to stress that. Fact sheets and grant portal training. Applicants must complete a request for public assistance or an RPA package. It's the very first step in requesting public assistance. It's, again, found on the DHSCS webpage, and you want to do that as soon as possible. You fill out the documentations, you write on the webpage, it tells you who to send it to, you send it to them, They go through it, submit it to FEMA. FEMA reviews it. They approve it. They let you know, or if they need more information, they'll be in touch. Once that's approved, then DHSCS will come back and give you access to the grants portal. All of this will be done going forward after that point through a grants portal specifically for this purpose. And I believe then you're assigned a DHSCS representative that will work with you. Once FEMA approves the RPA, pretty much what I just said, DHSCS will provide your organization's FEMA coordinator with access to the FEMA grants portal. So that was really a super tops of tree level highlights of some information that are pretty important. I'll go over some of the frequently asked questions. Again, DHSCS on their website, their webpage, they have frequently asked questions. I kind of picked a couple that I thought might be relevant here. One question was, are any costs associated with remote working capabilities, distance learning, or essential face-to-face services becoming remote eligible for reimbursement, such as Zoom, WebEx, Chromebooks, etc.? And unfortunately, the answer right now is under current FEMA policy, no. No, those are, I forgot the terminology, Joe's can tell you, but it's additional cost of doing business. Are legal fees covered? The answer is no. Is PPE reimbursable? If there was a cost to the organization and the PPE was used, then yes, it will be reimbursable. So if you had masks or gloves donated, you didn't pay for those, so no, you don't get reimbursed for those. Are lost revenues eligible for reimbursement? So if you tip, Joe's can give better examples on this too, but if you depend on certain money coming in, but it's not coming in because of this whole COVID crisis, you can't claim those. So lost revenue is not reimbursable. Are hours worked from home reimbursable? The answer is no. Is hazard pay reimbursable? And this is one that comes up often. Only if triggered by the applicant's pre-disaster personnel policy, and only for overtime while performing eligible emergency protective measures. So if hazard pay became a thing or became a policy after COVID-19 started, no, those costs will not be reimbursable. They would need to be reimbursed before, or would need to be part of the personnel policy before this started. Is child care for essential workers reimbursable? Under current FEMA policy, no. Are increased regular rates reimbursable? No. What is the maximum amount one can request? And the answer is there is no maximum. Another big question is, are cleaning services reimbursable? An eligible applicant may seek reimbursement for reasonable and necessary costs for disinfecting its common areas to prevent spread of virus. For example, a hospital may incur costs for more frequent disinfecting of areas where staff, patients, and/or members of the public potentially exposed to the virus are meeting for purposes of diagnosis and treatment. So it would include not only the testing and treatment rooms, but also laboratories, waiting rooms, lobbies, cafeterias, hallways, elevators, etc. What is the timeline for receiving funding? That would depend on the nature of your claim and the quality of supporting documentation. And are costs associated with reopening facilities eligible for reimbursement? This is still under the FEMA review, and there's no guidance at this time. Hopefully that'll be forthcoming. So again, these were frequently asked questions I took right off of the DHSCS website. There are others out there, but we're going to turn this back over to McTack to open up the question and answer portion of the webinar. And again, thank you all for listening in.
Great. Thank you so much, Mary Beth. So I am just going to remind people, as our presenters get ready to answer some questions, that if you haven't chatted in your question, please do so using the chat box functionality. We've gotten a number of questions throughout the beginning presentation, but I just want to remind folks to please do chat them in now, and we'll address as many as we can. I do know that we've gotten some questions about, if this information and this recording, these slides will be available afterwards. Yes, they will be. Once the recording is downloaded, we will be sure to share it with everyone who registered for this webinar along with the slides. So you will have access to all of this information and you can refer back to it. So with that, I am just going to start to read through some questions. And for those who, we're going to try and address as many questions as we receive, but please know that if we aren't able to address them all, our state partners who are on the line with us today will receive everything that we collect. So even if it doesn't get answered, our state partners will still have an opportunity to review it and follow up, okay? So we've had a couple questions, Mary Beth, Joe, and Joe, about the September 19th deadline. It's quite a popular question, actually. And so we're wondering, I guess folks are wondering, does the 6-month time limit mean that they have to register and apply by 9/19, submit reimbursement by 9/19, or are only costs expended by 9/19 covered?
Good afternoon. This is Joe Stinson with New York State. That deadline is the end of the period of performance for most Category B work, which means your costs must have been incurred prior to that deadline. Some specific types of emergency work, like the food purchase and distribution policy and the non-congregate sheltering policy, have separate periods of performance. They're initially for 30-day periods, and any extension beyond the 30 days requires approval from FEMA. So depending on what type of work the specific cost is associated with determines what period of performance applies. But for most things, like if you're purchasing personal protective equipment or disinfecting supplies for your facility, those costs would need to be incurred prior to September, I believe it's September 20th. I don't know why it says 9/19. September 20th would be 6 months from the declaration date.
Thank you, Joe. Just a follow-up actually to that question. So if someone is wondering if there's a possibility that the September deadline will be extended, as I think folks are hearing that the crisis, it's expected the crisis and the need for protective measures might continue past then.
Yes, there is a possibility it'll be extended. That's not unusual. But FEMA has indicated that, they will probably cut off reimbursement when the public health emergency comes to an end, which I believe is defined by Health and Human Services, if I remember correctly. But as you suggested, we don't know when that's going to be. That could go on for some period of time. So we'll just have to see how that develops. But if there is any extension, we will make applicants aware of that. Also, just going back to the first question, I want to make it clear that although the period of performance identifies the deadline for when costs are incurred, we do encourage everybody to go ahead and submit your request for public assistance. There's basically a two-step process here. First, you have to be approved as an eligible applicant in order to participate in the disaster. That means you need to submit your request for public assistance and have that reviewed by us, DHSES, and FEMA, and be approved. And once that happens, you will have a grants portal account established, and then you will submit your project in the grants portal, or projects if you have more than one. So just keep in mind that initial step, getting your RPA approved, is something you want to go ahead and do as soon as possible. And then once you have your grants portal account, you can develop your project there.
Great. Thank you so much for that additional information. I'm going to shift to quite a few questions we've gotten around the what is covered topic area. So I think these are pretty specific questions, maybe a little bit more than what was included in the very helpful FAQ. So I'll just go through those, and state partners, if you've got to take this back, figure it out, just let me know. We'll make sure this is captured in our question document. So someone is wondering if the purchase of PPE for clinical operations of an Article 31 clinic would qualify for reimbursement.
I'm sorry, someone's going to have to translate that to layperson terms for me. What is an Article 31 clinic?
Sorry, Joe, it's an outpatient clinic for the Office of Mental Health. And Mary Beth, if you want to add more to that, that was my brief summary.
Sorry, I was trying to unmute.
It's okay. It's all good. All good.
I guess my first question would be, did the clinic itself purchase the PPEs? Because if it was, again, if you didn't purchase it, then it wouldn't be reimbursed. There's nothing to reimburse.
Mm-hmm.
Yes,
and if I could just continue on that. So
right.
Keep in mind, this is connected to the COVID-19 virus. So I'm not familiar with what your normal clinical operations are. If you normally use PPE in that environment, then it's not necessarily related to COVID-19. But if you're purchasing PPE because of COVID-19 that you don't normally purchase, and you're using that to protect your staff and your clientele from transmission of COVID-19, then that should be a eligible cost.
Thank you, Joe. So our next question
Can you hear
is.
Me?
Oh, yes, we can hear you.
I'm sorry. I was trying to get in there for a moment, and evidently something was wrong with my communication. This is Joe Colarafi. I just want to add something to the first issue where Joe talked about the period of performance, the September 19th, September 20 issue.
Yes.
I just want to clarify some things that FEMA eligibility, the cost must be incurred within the authorized period of performance. That started on January 20th. It's currently open. However, FEMA may close that if the health emergency is taken down by the Federal Department of Health. If they, for example, close that health emergency on July 31st, that ends the period of performance, and your costs must have been incurred from January 20th to July 31st. The September date is the period of performance, meaning the time that you have to complete the work for the emergency protective measures. So you need to look at both of those items when you're looking at when your eligibility for work starts and ends. Period of performance is when the work must have been done within. The incident period, and the period of performance for the work is when it must be completed.
Thank you, Joe, for that clarification. That's helpful. So I'm going to just pivot back to some more questions about what is covered. So someone is wondering if there can be some examples that are given, and this might be a question for you, Mary Beth, because this is a specific OMH question. Some examples of OMH contracted services regarding eligible work. This individual is most interested in licensed and unlicensed housing costs for cleaning and PPE. I'm not sure if that gives enough information to get it, for an answer, but just wanted to see if, Mary Beth, if you might be able to help with that one.
Well, I think this kind of falls, you're talking about specific licensed and unlicensed.
So I am going to do my best to intuit from the question that was chatted in. And if this individual who chatted in the question wants to clarify, please do. But they're asking for some examples of OMH contracted services regarding eligible work. the individual asking the question, not Meg. They are most interested in licensed and unlicensed housing costs for cleaning, PPE, etc.
So I think as long as it's a licensed contractor and it's directly related to COVID, and Joan Joe, please hop in. But cleaning costs, if it's to protect the community or whoever's there from COVID, that those would be eligible costs. Again, it has to be directly related to protecting people from COVID. So I think cleaning costs would fall under that. Would you agree, Joan Joe?
Who's going to be the applicant? This is one of the questions I have. These facilities, and I'm not sure what licensed and unlicensed means, are these facilities under someone that, or an organization that is an eligible applicant? Who's responsible for the costs or for doing that work?
So the person who is asking that question, I guess you would have to figure out, are we an eligible applicant?
Got it. Okay. So for the question, we have an answer and another question for them. So thank you both for that. Okay, so just moving right along, another question. Someone is wondering if an agency would have to exhaust all other funding, such as donations or grants, before asking FEMA for reimbursement for PPE and cleaning supplies.
Is it my question would be, is it just general gifts and donations, or was it gifts and donations with the intent to purchase the PPE?
Got it.
And if it was with the intent to purchase PPE, I believe anything that those funds would have to be used for PPE, and if there's some left over, and again, meeting all other eligibility requirements, then that net cost would be eligible for reimbursement. I've just hopped in there, Joe and Joe. Do you agree with that?
She's basically correct. When we're talking about fund donations, money being donated, and if it's donated for a specific purpose, and the applicant is submitting a project to FEMA for that specific scope of work or purpose, then it has to be deducted. If there are costs that exceed that, then as long as they meet the threshold for the $3,300, they can be submitted to FEMA.
Okay. Okay. Our next question, thank you both. The next question is, what administrative costs related to dealing with the virus are considered eligible?
Okay. So
go ahead, Joe.
Yeah, sorry. It's not administrative costs related to dealing with the virus. Management costs are administrative costs for developing your FEMA project. So the time you're spending in this webinar right now, the time that you spent if you attended the applicant's briefing put on by DHSES, the time you spend actually submitting your project in Grants Portal, following up on any questions that you are asked by DHSES or FEMA. Those kind of administrative tasks are the management costs that we're talking about.
In addition to that, you're also talking in there the time it takes you to gather all of your documentation, your invoices, your contracts, any of those kinds of things, your proof of payments that you must be submitted, and the time to load them into the portal.
Thank you both. I think those are incredibly helpful and detailed examples. So I think that's exactly what this participant was looking for. Okay, give me a moment. I'm just going to scan through some more. We've gotten a ton of questions. So thank you for everyone who's chatting them in. I'm just going to try and sort through and make sure I'm asking one that has not already been answered. Okay, so this is a question, an example of an organization that provides general social services to children and families, but that doesn't typically include food distribution. However, in light of COVID-19, food distribution has become an urgent need of the families that they serve, as well as food distribution such as purchase and delivery. They're wondering if those purchase and delivery are to these families that they serve are an eligible expense.
Assuming the organization is a PNP, you need to contract with a state or local government entity to do that work, and then that governmental entity would seek reimbursement from FEMA.
But I also suggest that you take a look at the website and read the FEMA food distribution policy because it has specific populations and specific criteria. And as Joe mentioned before, it has time frames. It has a 30-day time frame that can be provided. And it has specific populations that are eligible under the FEMA Public Assistance Program. One of the things that FEMA looks to is, are there other federal agencies who have the responsibility to provide assistance in these areas? And as everybody knows, there is a lot of funding that is being provided to a lot of agencies directed to assisting individuals, families, businesses, public facility organizations, and private not-for-profits from a variety of streams of incomes coming in. So there may be others that may provide support in that area that FEMA may make not eligible.
Thank you for that. Okay, another specific example. Someone's wondering if twice weekly COVID testing for nursing homes and adult homes would be an eligible expense for reimbursement.
You want me to take that, Joe?
Sure.
Okay, so yes, if you have a nursing home that is providing long-term medical care, it's that type of facility, and it's either a non-for-profit or a governmental county nursing home, et cetera, they would be eligible to conduct testing and be eligible to submit to FEMA for reimbursement. If it is not one of those entities, and it's a adult care home, for example, those individuals would have to contract or would have to go to a legally responsible governmental entity like the state, for example, or if they happen to be in a county, they could go to the county government, and that would be the organization that would have legal responsibility to conduct the testing.
Thank you. That's helpful. Thank you. The next question would be, someone's wondering if they can submit prospective costs, or do they have to be retrospective costs to be eligible?
I assume what they're saying is, can they submit estimates for future use? And that answer to that is yes, as long as they have a basis for the estimates that they're providing. FEMA can accept estimated costs, and there are certainly procedures and assistance that we can provide on how to formulate those costs.
Thank you, Joe.
I just want to add on to that thought for a minute and tie back to what Joe Colrafi mentioned earlier about the end of the public health emergency. If you are purchasing materials with FEMA funds, and FEMA is going to want to know that you actually used those materials for the public health emergency. If you have materials that you purchased with FEMA funds left over at the end of the public health emergency, FEMA is going to want you to account for those unused materials. So you're going to have to, basically identify what the market value of any unused materials is. If that market value is greater than $5,000, FEMA will deduct that market value from the eligible costs of your project. The thought being that you've been made whole for the stuff that you used during the public health emergency. Now you have leftover materials, and you could always go out and, sell them on the open market or use them for your stock for future use or what have you, but only the materials actually used during the public health emergency are entitled to reimbursement from FEMA.
Okay, thank you for that. All right, let's see here. Someone is wondering if a house of worship is eligible for assistance under FEMA 4480.
House of worships are eligible as a non-critical but essential P&P. Again, as the presenter mentioned, that pyramid of eligibility, they have to meet all of the eligibility criteria and then determine what work they are doing and how it protects the public health and safety from the COVID-19. Things that I could see that might be eligible would be if they're continuing to hold services and they're now having to clean and disinfect the common areas to protect the public health and safety from transmission of the virus. Those costs could be eligible providing they meet the minimum thresholds.
Thank you, Joe. Okay, let me scan for another question. I'm going to start to jump from this area of what is eligible, only because we've done a lot of answering here, and I want to give time to some of the many other questions that we've gotten. So let me try and wrap this section up. Okay, so this is a clarification question, I believe. So in terms of those, this is going back to the kind of administrative cost question. And I think you gave a lot of great answers, Joe, on what could be eligible. Someone is wondering if the time spent by administrators in meetings, planning for the disaster would be covered by this.
No, they would not. The
No.
management costs that we're talking about have to be directly related to processing your FEMA project.
Got it. Thank you for that clarification. Okay, let's see here. So I think we've answered this, but just to clarify, someone's asking if a facility generally purchases PPE for their normal course of business, but the costs were over the normal budgeted amount. Can that be covered?
They can be covered if the applicant can demonstrate that those PPE items were used directly in Category B work to protect the public health and safety from the COVID-19. They're going to have to be specific as to what was used and how it was used and how it related to the COVID-19.
Okay, thank you. Another question, someone's looking for clarity around the $3,300. Is that the minimum cost for all expenses together?
That is a cumulative cost for your project. So the individual project that you are submitting must meet a minimum project threshold of $3,300, and that is after the deduction of other proceeds toward that. So if you have insurance, for example, let's say you have a project for $10,000 and you receive $8,000 in insurance on that project, leaving you $2,000 in cost, you do not have an eligible project.
Okay, thank you. All right, let's see here. Okay, so this is a question about, let's see, can costs of testing staff for antibodies be covered?
I think we're talking about tracing, contact tracing.
Okay.
If we're talking about contact.
Yeah, if we're talking about contact tracing, no, let's change that question then. Let's answer it that way. If we're talking about contact tracing,
yes,
go ahead.
Yes, those costs are eligible. The question is, do they have the legal responsibility to do that? And procedures specific to contact tracing are being developed, but it is our understanding that the costs of that are going to be eligible, providing that the eligible applicant is conducting them.
Okay. Okay, let's jump here. So the next question. Okay, so this is a question, Mary Beth, you might need to weigh in here because this is specifically kind of asking OMH. So someone's wondering if are additional costs for PPE for OMH programs the legal responsibility of the provider or for OMH? And I think Mary Beth might be muted. Caitlin, if you might be able to oh, there you are. You're unmuted now. Yep.
I'm sorry. I got part of that, and I was trying to answer it, and then there was a twist in there for me. So could you read it again?
Yeah, of course. Are additional costs for PPE for OMH programs the legal responsibility of the provider or OMH?
Okay, I'm going to have to go back and ask that of my higher-ups and see what I can come up with.
Okay, that is all good. Okay, another OMH question. Let's see here. I think just, Mary Beth, there are a couple questions around legal responsibility in terms of PPE in OMH programs. So I think you'll see all the questions that have come in, but just know that there were like 2 or 3 that came in about that.
Okay. Okay. Yep.
And for folks who answered those, that's the reason we're not addressing them right now, because Mary Beth is going to take that back. Okay, just didn't want you all to think I was ignoring them. Okay, let's see here. Okay, so here's a question about the portal, actually, the FEMA portal. So the portals for the hospitals in the healthcare system are all active. We have an account through the New York State Grants Gateway. Is the streamlined project application the only thing to be submitted to have the project considered for FEMA funding at the initial stage?
Well, you can't submit your project through the New York State Grants Gateway. It has to be submitted through the portal because that's a FEMA-specific system and no other system interfaces with it. So if you have an account in New York State Grants Gateway, it has nothing to do with FEMA projects.
Thank you. Okay, let's see here. Is there a central place where all FEMA New York State decisions are posted?
We don't normally post decisions because decisions like for eligibility and so forth are based on the individual circumstances of the situation and project. What we do post is criteria, policy, guidance, fact sheets, things of that nature, and you'd find that on our website, I think as Mary Beth pointed out at the beginning of the presentation.
Okay. So I think what folks are asking, Joe, is, will they be notified directly, or is there a place they should be looking to see where the final funding, decisions are made?
if we're talking
They will be
about
notified directly.
Okay.
Yeah, if they're submitting a project, they will be notified through the portal of the status of that project.
Thank you. All right, let me look. I know we've got about a little more than 5 minutes, so I'm going to try and scan and get to some questions that we haven't been able to address yet. So this may be in the slides, and forgive me if I've missed this, but if folks have a question as they go about the application process, who should they contact or reach out to?
Once they are approved as an applicant in the disaster, they will be assigned a representative from our staff, and that will be their primary point of contact for all questions and assistance to get their projects in.
Great, thank you. All right. Someone is wondering if there is a New York City FEMA application process outside of or separate from the New York State application process.
There is not. New York City is an applicant under the state. The way FEMA works is FEMA's relationship is with the state, and everybody else is a subrecipient and has to go through the state. The only exception to that is nationally recognized tribal nations.
Got it. Okay.
There's one question here I'd like to address, if you don't mind.
Please go right for it.
And this talks about reimbursement. The federal declaration for this disaster is set at a 75% federal rate. That's the federal share. And what that means is that it leaves a 25% local share for applicants. So if you have a $100,000 project, FEMA is going to reimburse you $75,000. Currently, the remaining balance, the $25,000, is called the local share, and it's the responsibility of the applicant. Right now, we have a request into the president. The governor requested to the president to make it 100% federal share. Okay, but until that gets approved, we're still at 75%. One way you can offset that 25% local share is to capture donated resources. So if you have volunteers who are giving their time in eligible work, or you have people that are donating materials, a company decides to donate you 10 million sets of gloves, or you have somebody that donates an ambulance for you to use. All of those can be considered donated resources. Capture all that information, and then if you still have a federal share left at the disaster, you can apply the value of those donated resources against that local share, and FEMA will pay you for that.
Thank you, Joe. I saw that is I think that's the most recent question we got in, so I whipped right down to the end of our question list to just make sure I captured that answer. Thank you for getting that one. Okay, next, let's see here. Okay, so someone is wondering if an applicant can have more than a single user accessing the portal.
Yes, the applicant that has the account can designate who they want to be users in their portal account.
Great. Okay, let me just check the next question. Let's see here. Okay, so this individual is wondering if they could submit their comprehensive COVID-19 response as one project, as there are many different efforts undertaken, including construction, equipment, purchasing, the ramping up of testing sites, et cetera. So I think they're asking, can all of those fit under the umbrella of one project for application?
It can. Once you are approved as an applicant, we'll have somebody, as I said, assisting you and formulating your costs and work into logical projects. But there's nothing prohibiting applicants from submitting one Category B project. It all depends on what makes sense. In some cases, we do recommend that projects be separated because of different criteria. For example, non-congregate care or food distribution that have additional criteria and limitations, and that may take some time to get through those, or they may be more complicated or document intensive. So we might suggest separating projects, but there's nothing that prohibits an applicant from submitting one project or multiple projects, depending on what is best for them.
Thank you. There's a question on here that given that we are right at the end of time, I'm going to have to cut down on, but I think the gist of the question is, how long does the process take once someone submits, their initial application while it's under review? I think they're looking at, they're in the portal, they're looking, and it says, currently under review. How long can they expect this process to take before they're either notified that, they're moving on to the next step, or what the next step would be?
The process for reviewing of the RPAs done at FEMA is a little bit more complicated because it's done by FEMA staff. If we're talking about projects, again, it depends on the project, the nature of the project, the documentation, the complexities, and the FEMA workload. So projects, if they're on the expedited list, can certainly be moved very quickly. If they're more complicated, it's going to take more time.
More time. Well,
Meg,
go ahead. Is that somebody else? Yeah.
I just want to hop in real quick and let everybody know that there is another applicant briefing next Wednesday at 1 o'clock. So if you have other questions or you want to get more detailed information, I would strongly encourage you to hop on that website and look at that applicant briefing schedule and register for it.
Thank you, Mary Beth. And thank you, Joe. And, just speaking of more time, we actually are out of time for this afternoon. So I just want to thank everyone who chatted in your questions. I know there's a number that we didn't get to address, but I really want to thank our presenters for helping us to kind of talk through all of these nuances and details. And hopefully you're able to walk away with a bit more information about this process, and we are going to send everything. Like I said before, all the questions that were sent in, our presenters will be able to see them, and we'll make sure that, there is some follow-up. So thank you again for everyone for chatting in your questions, for joining us today, and to our wonderful presenters for helping us to disseminate more really valuable information and to address some of these questions. So thank you all.